Hey guys, Dr. Tim Uselton, and I am here to talk to you today about an incredible breakthrough treatment for osteoarthritis of the knees. Okay, that's when the joint spacing in the knees is starting to wear thin, and you're starting to see bone spurs and evidence of wear and tear signs on an x-ray of the knee. Usually it's classified or qualified as early morning knee pain. You can also get pain when you're stagnant, when you've sat for a while. Usually when you move around, it kind of lubricates and feels a little better. Also, like I taught in earlier videos about OA of the knees, it's not hereditary, it's a wear and tear only type of condition. So the recommended treatment of choice is something called HA injections. HA is an acronym. It stands for, or it's the abbreviation of hyaluronic acid. Hyaluronic acid is plentiful in the human body. It's in our weight-bearing joints. We have it in knees and in hips. We even have some in shoulders, which are non-weight-bearing joints. So it serves as a cushion or a lubricant around the edge of the bones when bones are articulating with one another. So if this were my knee, then right in this space right here between the top bone and the bottom bone as we bend, then there's a little layer of gel. You know, there's bone and then there's cartilage and then there's meniscus, and all around that area is this gel called hyaluronic acid. So we can actually replenish that hyaluronic acid to your knees through a series of injections. And this was once called the rooster comb shot, because they derived the HA from the comb of a rooster, like the red thing on their head. Okay, inside of that there's a lot of HA, and that HA is bioidentical to the human HA, so we could replace our diminished HA in the knees with that. Well, that was 20 years ago, and now the technology has gone so advanced that we have better bioidentical HA than you can get from that of a rooster. Also, there's no allergies to eggs or poultry or anything like that when you get these other HAs from these pharmaceutical companies. So we actually replenish the HA inside the knees, and it's recommended that replenishment happen every 6 weeks. Excuse me, I said that wrong. Every 6 months, not every 6 weeks. So every 6 months, you'll be getting an additional supply of that HA, and as long as you're consistent with doing it every 6 months, you can push off, sometimes permanently, the fact that you might need a replacement. Oftentimes people come in here and say, oh, you know, Dr. Tim, I am bone on bone. I've heard bone on bone hundreds of times. And you know how many times I've seen a condition where the knee was actually literally bone on bone? One in 25 years. Because the textbook says that if you can bend your knee more than 5 degrees, like if you can go to there, if you can sit 100%, that's 90 degrees. But if you can bend it more than 5 degrees, then you aren't bone on bone. There's a space there that'll allow that. If they're bone on bone completely, you cannot physically bend it. There's not enough room for that mechanism to do this, if that makes sense. So bone on bone is a condition that HA will not help. HA is geared at mild to moderate cases of osteoarthritis. Severe bone on bone, you can try it. Some people might get relief with it. Again, I've only seen it one time, so yours is probably a condition that it will help, because most people that even say they're bone on bone, they're not really, because we take the x-rays with their knees bent and they can bend them. The HA replenishes, resurfaces. It's like putting a WD-40 can up against a squeaky hinge on a door, and now the knee just moves better. It makes a little squishing sound when you first get the HA put in there, and you can bend your knee and feel it. But the HA shots done every 6 months will decrease your knee pain. Most of the time, within a few days, the first round of shots, within a few days of that, you're already experiencing up to about 40% decrease in pain. But then when you get a full treatment of it, and you do it again at 6 months, and then you do it again at a year, and you do it again at 18 months, then you really start to compound the effects of this HA, and you get more of it in you. If you do one and never do it again, eventually all that HA will leak out of the knee joint, just the way the HA that was in there at the beginning leaked out, and you won't get anywhere. You won't gain any traction on improved symptoms with HA. So HA is very beneficial. It's a lubricant, it cushions, it's covered by insurance every 6 months. If you got it once and they approved it, then you'll always get it again because they know it works better, and they're trying to avoid the $60,000, $70,000 knee replacement surgery as well as an insurance company. So we do that as treatment for osteoarthritis of the knee. And if you have any other questions or need additional explanation about HA and what it stands for and how we get it and where it comes from and how we put it in, then just put comments in this video below, and we'll be sure to reach out to you. I'm Dr. Tim with Trinity Integrated Medical, and I appreciate your time today. Check out my other videos right here.